student. Today we are going to study Standard 10th subject Yoga, Health and Physical Education. Lesson 6 Approved Therapeutic Method Part 2. In the previous lecture in Part 1, we got the information of Ayurveda, Yogopchar, Homeopathy, Naturopathy, Unani treatment and Allopathy method. Now today we will get information about other points in this lesson. Prescribed and unprescribed medicine. The medicine which cannot be sold without the prescription of a doctor are called prescribed medicine. Before using such medicine, one has to understand all the instructions of the doctor regarding the medicine. For example, if the instructions are not taken into consideration, it may lead to serious result. Hence, such medicine cannot be given without the prescription. Over and above the medicine can be sold as per the instruction and in the prescribed dose. In the case memo of such medicine, the information regarding the batch number must necessarily be written. Loose tablet cannot be sold. The tablets are to be given in the prescribed number and properly packed. Unprescribed medicine can be purchased from any medical store, like purchase the household things. A purchaser has to use these medicines for household treatment. Even then, the best thing is that such medicine also should be purchased as per the advice of a doctor. Unfortunately, the rules regarding the medicine are not observed. Even then, the medical storekeeper easily gives such medicine. They give loose tablet also. As a result, the condition harmful to the health is created. Hence, the government and the vigilant institution should start instant movement and the people should be saved from such action. Addiction medicine. Medicine are to cure the disease. The medicines, if taken in more than required proportion, it become harmful. Some medicine are such that a patient become addicted to it. An addicted man always takes such medicine in more quantity. At the end, the symptoms of the bad effect are seen in the body of such a man. Some such medicine are as under: intoxication and sleeping medicine. Diazepam and such other medicine are given to an individual suffering from insomnia. Their use make an individual addicted to it. Such medicine affect the nervous system. The long-term effect decrease the efficiency of the mind. Cough syrup. Most of the cough syrup there is a medicine prepared from the opium, which suppress the cough. The addiction of such medicine harm to mind. Painkiller medicine. We see the addicted person taking simple as well as actual analgesic medicines. Such acute medicines harm the stomach, kidney and other organs of the body. Amphetamine. This medicine is given to an individual to awake him who suffer from excessive sleep. But this medicine harms the addicted one and it creates in him violent feeling insistic. Mental disease like frustration, stress, anxiety, etc. medicines are prone to addiction. Hence, one should remain acquainted with such medicine having addiction quality and should remain aloof from their long-term use so that he can be saved from its addiction from encircling grip. The risk of the self using medicine and the medicine of the quack. Even in simple household treatment, some are provide harmful and ineffective. For example, to apply formation in all type of swelling is a matter of fact. The swelling in any injury is become of minute breaking of a internal capillaries, capillaries in which blood comes out, but it does not have any way to go outside the skin. Hence, the blood collects around the muscles under the skin, where swelling is seen. In such swelling, one should rub the ice over the swollen part of the body, which stop the bleeding outside. Giving formation immediately after the injury does not stop the bleeding. On the contrary, the blood keeps on flowing and excessive swelling in occurs. When there is a dog bite, sprinkling of chili powder on the wound causes tolerable irritation. It will be of no use. Sometimes the druggists are unknown to the hazard of particular medicine. Hence, such medicines should not be purchased from him to avoid the possibility of occurring big difficulties. It has been noted that intake of aspirin sometimes creates the ulcer in the stomach and start bleeding. Some painkiller medicines have side effect of decreasing white blood cells, which in turn decreases the resistance power of the body. Hazard of the medicine from quack. The unqualified quack make such much use to the modern medicine, in which there is possibility of great harm. For example, antibiotic medicine and steroid medicine. Antibiotic medicine. When there is fever become of any infection or even without infection, unnecessary antibiotic medicine are given. Mostly, such medicine are not at all necessary. Sometimes their selection is wrong. Their proportion sometimes is also in more or less degree. The quack does not know as to how many times in a day the medicine is to be given. Once the antibiotic medicine are continued, they should be continued for a specific period which the quack does not know. Steroid medicine. Steroid medicine is very much powerful. It is to be used only in a specific serious illness. For example, allergic shock. Mostly it is widely used to reduce the fever or for better feeling of the patient, but it suppresses the symptoms of the disease and reduce of when is the resistance power. The internal secretion of the gland reduce. In critical condition, the body cannot resist properly. Expiry of date. Manufacturing date of medicine and within what period it can be taken in use, that is, manufacturing date and expiry date written on the vapor of the medicine or either on the bottle or any package. The time limit can be 1 year or even more than that. If if expiry date is over, that medicine cannot be used because the quality of that medicine gets reduced. Again, there is no mention as to what will be the side effect. In short, a medicine after the expiry date should not be used. As a precaution, one should always read the expiry date at the time of purchasing it. By mistake, if you purchase it and when you go home and come to know that the expiry date is over, you should go to the druggist and give it back and should purchase the same medicine of which the expiry date is not over. Next point, the harmful effects of tobacco and liquor. Liquor and tobacco are to be greatest enemies of the human being of the present time. These two collectively harm the human being so much that it is not done even by the nuclear bomb. Because of these two vices, an addicted person die every after 3 minutes. Liquor. In liquor, there is ethyl alcohol element. In different type of liquor, the proportion of this element is less or to more. These elements make an individual addicted to it. Liquor make great harm to an individual physical, mental, social and at family point of view. There is a belief about the liquor that if taken in small quantity, it advantageous is not correct. Once started taken it, its proportion goes on increasing. The liquor drunkard lose him mental balance. As a result, the crimes like violence, rape, etc. go on increases. The adverse effect of liquor are seen in the internal as well as the external organs. The harmful effect of liquor, there is a decrease in memory power and concentration. An individual become prone toward frustration, delirium, bad behavior and violence. The skin of the face become dry, there are wrinkles on the face, there is difficulty in coagulation of blood, liver is damaged, the possibility of developing cancer increases, there is tremors of the hand and numbness of the finger and minute pain. There is swelling in the digestive system because of malnutrition. There is vomiting and indigestion. Ulcer in the stomach, swelling on the pancreas, imbalance in the movement of the joints. There is numbers in the thumb of a leg minute span. The defect is created in the reproductive system. Tamaku. The killing elements nicotine in tobacco is responsible for addiction. The effect of addiction of tobacco are not seen immediately like those of liquor. After a long time its killing effect are seen. That is why tobacco is called slow poison. Tobacco is taken in different forms. BD and cigarette in smoking form, gutka in the form of chewing and cleaning the teeth. But tobacco in any form has the capacity to be addicted to. It is dangerous for health. The harmful effect of tobacco: foul smell in the mouth. The taste cannot be enjoyed because of the harm to the nerves. There are ulcers in the stomach, in the mouth. The mouth become tight. Sometimes it becomes so tight that it can not be opened to enter the food into it. The gum of the teeth become weak. Teeth get caries. Digestibility become weak. Lungs become weak. Breathing capacity decreases. There is possibility of developing cancer disease. Illness of heart increases. High BP increases. Artery become nerve and the disease are developed speedily. The possibility of the paralysis and gangrene are more. In pregnancy, the embryo is suffered adversely. Nervous system is slackened. Adverse effects are seen on all the organs. Life quality decreases. If there is someone near the cigarette smoker, the smoke enter in his breath on that one, which has adverse effect in some proportion. In the world, every 6 seconds, one individual died because of inhalation of tobacco. Next point, health framework. Health framework at village level. At village level, the basic facilities of the health strength of the doctor and expert and the facilities affecting the health like drinking safe water, gutter, latrine facility, roads, light, etc. are less in comparison with city. For about 30,000 population, one primary health center and one doctor along with his team are provided. Under primary health center, 5 to 6 sub-centers are provided, keeping in mind 5 to 6,000 population for each sub-center. Primary health center are connected with general health center and district hospital for intensive service. Over and above at this level, syphilis service Health institution and private medical dispensaries are also there. Second, health framework at city level. At city level, there are government hospitals, general health center and other health facilities. City health center are providing treatment for basic illness, vaccination and treatments, family welfare work, area cleanliness and removal dirt of the dirt. In city hospital, basic medical service, operation and admitting the patient in the hospital, the treatment facility are given by the experts. Over and above, there are hospital with the spirit of service, health institution and private hospitals, medical dispensaries and laboratories also are there at this level. Third, health framework at district level. There are district level hospital, medical services and health institutions which provide all the service regarding health. Over and above, at district level hospital with spirit of service, health institution, private medical dispensaries and the laboratories which given services. Fourth, health framework at state level. The Health and Family Welfare Department of the state organization National Health Program and gives guidelines regarding the implementation of policy and law and keep the supervision and giving guidance at state level. Fifth, health framework at national level. At national level, the Ministry of Health and Family Welfare give health policy program and service regarding the formulation of the law. The government medical research institution provide laboratory service at this level. Over and above the service of national level, medical institution with spirit of service and the service of private medical institution also are available at this level. Next point, institution with spirit of service of health and health education. Here we know that along with the government framework from the village to national level, the institution with spirit of service and private institution also given their service regarding the health in different form. The institutions with spirit of service are established by the individuals with spirit of service and selfless motive. These institutions do their work without taking any material profit in the activities of health. In Gujarat, there are few such institutions. These institutions stay along with the people. They try to understand their problems. At the particular place, if they find any deficiency, they go there and give the service. Some institutions work in the area of treatment in the cities. Some institutions work at the village level, especially in the backward district and taluka. Such institute are work as supplement the health work done by the government. They are as under first Bhansali Trust working in Banaskantha and Patan. Second, Seva Ruler working in Jagadia in Bharuch district. Third, Anjali working in Ranasan of Sabarkantha. Fourth, Anandi working in Panchmahal, and fifth, Seva, Chetana, and Savedna working in Ahmedabad. These institutions with spirit of service are like the lighthouse in health programs. These institutions are spreading their service light in the remote place where not no type of service is rendered. Such small institutions giving their service in the field of health and worth to be honored. Dear students, the lesson ends here. Thank you.